Hello, everybody. This is Kirk Davis, Executive Director with CAMPS, the Center for Advanced Manufacturing. I'm here today with great people from Regence, Brady Cass and Verity. And today we wanted to share what Regence is doing as a partner of CAMPS. We've been very fortunate to set up and work with Capital Benefit Services to create a relationship with Regence to offer health benefits to our members. And Brady and Claire, I have to tell you, in behalf of the members I talk to, you are providing, such a beneficial service that is, providing better benefits to our members at a lower cost through our group rate insurance, CAMPS Health Trust. But I want to say welcome and thank you. And this is a tremendous chance for us to get to know you better and to see behind the scenes of things we wouldn't maybe normally know about. So, hey, Brady, would you start off and tell us a bit about your position at Regence, and then Claire, I want to hear about your position at Regence.
Sure. Thank you, Kirk, for the opportunity to be with you this morning. Insurance isn't necessarily as exciting as manufacturing, but we do, we provide an opportunity to meet people where they stand in the time of greatest need, right? So my role here at the organization is I lead our association and affinity program line of business. So these special programs, such as the one that we created specifically for camps, fall under my leadership.
Ah, excellent. Thank you. Claire?
Yes, thank you, Kirk. So Claire Verity, I'm the market president for Regence here in the great state of Washington. I have been here just about a year. I'm a native from the Northwest, so I have a lot of family and others that live here, but I feel very privileged to be working with camps and with the membership within camps to bring them affordable care and access to a really solid network, I think, here in Washington and beyond. As a consumer of benefits as well, it's important for us to have that affordability and ease of access. And so it's really been a fantastic partnership, and we continue to find ways to bring better value and greater value to you and your members.
And that, that's exactly, kind of what I wanted to talk about. The pandemic has really put healthcare front and center stage in all of our minds. And I would love to hear a little bit of behind the scenes. What happened on your end during the pandemic? Because I'm sure your world changed quite a bit. And, what happened during the pandemic from your point of view?
Brady, you can start and I'll add a few comments.
Sure, you bet. So it's certainly is an interesting period of time in history, right? We're living through history in the making. The first thing that we wanted to do as we were faced with what was going to be a protracted period of time is ensure that our members, right, those of us that are members of the health plan, have access to the services that they need. So we did that by working with different organizations around the area to make sure that they had access to healthcare, that when the system started to shut down, those that needed urgent or emergent care could still get it, that they had access to that. I think in a certain respect, Kirk, we were actually well optimized going into the pandemic, because we made changes. We put things into motion well before this, not even anticipating that they would be needed to the degree that they would be. I'd call out the fact that we created a whole suite of products and services that gave people access to healthcare wherever they stand, right? And we did that well before the pandemic. So this access to telemedicine or nurse chat or however you wanted to interact with your provider was there, it was built. And so as people were forced to access services in a very different way, we were there ready to go. We didn't have to build up for that. It was part of our portfolio all ready to go. If you think about, your members, they're at camps that are working in a manufacturing facility, the ability to grab their cell phone and engage with the healthcare provider, whether it's physical health, behavioral health, either from an office, from their car, from their home, or those that need to go into the office, that entire continuum is there. It's all available to folks. So we made sure that people did not have to miss a beat at all through that.
Thank goodness.
Yeah, absolutely. And second to that is we really engaged. We did a ton of webinars for employers and for the producers just to make sure that the information we had from a public health standpoint, information that was coming through our medical directors, came to us and back out to those that had all these questions, right? The buyers and users of the healthcare. And we really doubled down our ability to share information in a timely manner.
Yeah, that was so helpful and so needed. And you bring up a really good point that you were prepared in advance, thank goodness. But what it opened my eyes to was how many different solutions you provide for members. So and again, so people I think understand going to the doctor or help in a time of medical need, but there's some really interesting solutions. Could you talk about some of those other solutions that people might not think about?
Sure. So I think one of the advantages that folks have if they were to get healthcare coverage through the Campus Health Trust, first and foremost, you have 25 different offerings, right? So
Yeah.
an employer constructs a plan to meet their unique needs. If you think about the diversity of your manufacturing clients, right? No two are the same. And so we've created a portfolio that allows people to do that. People expect us to kind of cover the basics, right? The blocking, the tackling. They expect us to print an ID card and to pay claims and have access to providers. When they really begin to dive into all of the other nuances that are out there, there's a lot of stuff out there that people don't understand that they have access to. Access to gym memberships, access to hearing aid discounts, access to pet health insurance. Things that we all have to deal with every single day that are embedded as part of your health plan that they don't realize. And that's all available either from your mobile device, from your desktop, or call our customer service team and they'll walk people through that.
So Claire made an observation in one of our previous conversations that it's like an iPhone that can do so many things, but you only use like 10% of those. So you're not really highly aware of the other 90%. So
Right.
Yeah, I think as people dive in a little deeper, which brings us to the conversation about your new mobile app. When did you guys roll this out?
So we've actually had a mobile app for several years. In the first part of this year, we actually refreshed the services that are available on that device. And so, as we talked about before, it's a conduit to receiving access to information and access to care that when and where you may need it. So some of the things that you can do from this device is you can actually pull up a treatment cost estimation, right? So if I've got a bad shoulder, right? I've had a bad shoulder for years. It's getting to the point where surgery will probably be imminent. So now I'm looking at what does that mean for me from a cost standpoint? Who do I go to, right? So I can search providers. What is a reasonable expectation of cost specific to my benefit plan? I can do that right there from my mobile device.
Wow.
You have the ability to search claims and all of that, but the tool is now designed to be this conduit for wherever you may be at in the healthcare continuum. And as data becomes more available, we'll be able to engage with members. Take a diabetic who may not have received their eye exam or the feet haven't been checked, or we don't have record of an A1C check. We see all that information in our data. Well, this registering with Regence.com, using the mobile device, the mobile app, you have the ability to push information out and say, hey, maybe it's time to reach out to your doctor and ask about this. That entire care continuum is all beginning to be integrated into that device.
Yeah, I don't know if that relates to artificial intelligence at all. Having some of that automated, but to push those messages and say, it might be time to check your eyes or double check this, and it's very helpful.
It really is. We partnered with a couple of different organizations that are really good at that. So if you kind of stick with somebody who may have type 2 diabetes, right? So we're making sure that they're getting the eyes checked, the feet checked, their blood sugar checked. Somebody who has congestive heart failure, we watch them for weight gain, right? So people with high blood pressure, how often are you checking your blood pressure? What are you doing to react to that? We have vendors that can send you a device that tracks that and it integrates into the system.
Wow.
So we don't have to guess, right? In their automated reminders, their encouragement to get in and do what we need to do, but with the things that we may often forget to do because our days get busy.
My goodness.
I'll just, Kirk, I'll just add a couple comments, I think, from your beginning question around, where were we when this pandemic started? And to Brady's point, which is a really important one, which is we were prepared. We had the resources, the technology, the things that we needed to make sure that employers, right, they were able to communicate effectively to their employee base, and then directly to members. I think that's really paramount in a time of uncertainty and a lot of, shifting sand with respect to what should I believe? Where is this information coming from? I think really people look to us as a source of trusted information, and we were able to do things on a consistent basis, getting communications out there, making sure that people were prepared to handle their own situation at the employee level. And I think when I think about how we really stood up at Regence, I mean, we had an individual who was part of the National Task Force in DC. So we had a very large voice at the table. Workforce stability and retention, is really not only during this pandemic, but now as we hopefully try to climb out of it, remains a very important concern and frankly, a reality for many is how do I keep and attract? And we want to make it easier for not only the employers, but for those within camps, but also for our membership. We don't want to make this an added complexity that's just really unnecessary. So I look at that. I also look at financial foundation. We have a really strong financial foundation that allowed us to do things like waive certain copays for COVID-related conditions and a variety of other things that we brought to the market so that we were able to be that leader for camps and for the employers within camps. So those are just two or three different kind of topics that really were, I think, important as we kind of transition through a very, very uncertain time.
I ended up speaking with several HR directors about, how important it was to get this information from somebody like Regence that they trusted. And so I think that you have become a trusted partner, with companies, to better understand the situation, what's happening, and what they need to be aware of to keep their people safe. So it's a great partnership from that point of view.
Right. Exactly. Yeah, I think that we just had so many things going on in our universe with respect to information, and to have this kind of ongoing trusted relationship with camps. Obviously Brady and his team really engaged to help make sure that we're making sense of things that are uncertain or are confusing. Some of the things I think Brady touched on. How do we keep that communication going? We had our medical directors front and center talking about whether it's conditions to be worried about, to vaccine awareness, to making sure that we kind of blew through some of those myth busters. We try to kind of say, here's really the facts. It's still evolving, but here is how we're going to help you navigate during this uncertain time. So that communication, having that financial foundation, having a voice at the national level, but also at the local level here in the state of Washington, really, really important. And I think that kind of carried us through these last couple of years.
Yeah, and I wanted to ask, and I want to thank you for that. Because we talked about a statistic that was surprising, but also I think it was helpful. And it was the idea that you have seen a kind of a dramatic increase of people asking for help with behavioral health or mental health issues. And Brady, I think you were saying there was something like 700% increase in those requests.
Yeah, it's pretty significant. I think, there's in every situation, there's always, there could be a silver lining. And I think one of the silver linings within the COVID period of time is we've reduced the stigma about asking for help. At the same time, we were able to engage with partners. There's a shortage of behavioral health providers, but we were able to engage with a couple of entities that gave us access to a virtual delivery of behavioral health, and the adoption of these tools have just absolutely gone to the roof, right? So when we remove the stigma and say it's okay to ask for help, and you give people access to that help, again, where they may stand, that can be their living room, it can be a doctor's office, it can be the front seat of your car, but give them access to those services. People were engaging, because this is COVID is an incredibly difficult period of time, right? For those like us, we sent 5,000 employees home overnight to continue to do their jobs, right? So now we're working at home with our spouse or kids in the background trying to manage teaching kids. It's just very stressful. The ability to reach out to somebody and ask for help and how do I manage and navigate through that? To me, it's heartwarming to see that people are engaging and asking for that help, and that we have the resources to be able to continue to carry them through that. If we allow people to bury those emotions and not address that, we will see a ricochet of other very expensive disease states down the road, right? So not only is this, we want to get people help today, we don't want people to carry this burden with them over a course of years that then turns into, heart disease or other stress-related illnesses down the road.
I was actually very happy to hear this. I think that it's a real tribute again to, I think, making it accessible, using the financial foundation, Claire, that you talked about, using the technology, and we're making this world a better place. Like you said, if we can solve stresses early, we're going to prevent so many of those stress-related conditions down the road. We discussed this. What's fascinating to me is I think what you do is very complex, and I don't think that many people can wrap their head around the complexity of healthcare today. So they just, they get an app and they have a connection with the doctor in the medical field. But one of the things that we discussed, that you kind of have your thumb on the pulse of what's important to employees. And so I'm hearing in the different offerings that you offer, but also in the number of plans, you guys are really focused on the end user, on the actual employee.
Mm-hmm. Yeah, I'll speak just for a moment, then Brady, please jump in. But we're all consumers. We're all consumers of the healthcare system. So I think we always have to kind of apply that self-awareness too of how would I want to be able to engage in the healthcare system. And I think what we're seeing and continuing to hear, we need to make it easier, meaning it should be just as easy as ordering something on one of your apps to get a ride share or to get a meal delivered and so forth. We should be able to say, I can get into this doctor and see this doctor within 2 days, and here's what it's going to cost me, and I can do everything online. And we've got to really kind of move into that arena. I think that the more and more out of this pandemic, I have a stat here that we looked at with respect to where our membership is moving, and they increasingly prefer the digital approach, whether it's shopping for a health plan all the way to paying their insurance bills online. So all of these things we're seeing higher and higher, from 73 to 82% wanting that digital access. So we have to make it easy, intuitive, and then understand, what Brady mentioned earlier, what is it going to cost me? I don't want to have any surprises. That's the biggest thing we also hear from. So how do we kind of reduce that hassle factor and make it an easier, more enjoyable process to see a doctor,
I can't believe how good it is, but it also tells me a little bit about how much even better it will get over the next several years. Mm-hmm. And, something we talked about is that employees aren't just making a decision when they take a job about pay. I mean, it's not all about pay, but a lot of times it is about those benefits. I know we were talking about some statistics earlier. I don't know if you've got some thoughts about the importance of these benefits to employees.
Yeah, we're kind of part and parcel with what's going on with the pandemic is this, what we're all referring to as the Great Resignation. I saw an author refer to it as the turnover tsunami, right? So, to your point, Kirk, when people join an organization, they join for a variety of reasons, right? They join for compensation, they join for culture, they join for opportunity, but they also join that organization because of the benefits. They need to be competitive and deliver a value that's important to that member. And so, to Claire's point, we build products and services with the member in mind. Everything we do has the member, at the top of mind. But I know a lot of your customers, a lot of our customers are struggling right now to keep people employed, right?
Yeah.
This great resignation, it's real. I mean, it is
Yeah.
real. People leaving the workforce to either go do different things or just leaving it all altogether. I saw something, I think it was a Harvard Business Review that said, it depends. There's an interesting statistic. You can look at it two ways. 59% of the workforce that they surveyed said they're not thinking of leaving, right? So 59%. That means 31% of the population is, right?
That's a lot.
You look around your organization and think, oh my gosh, a third of my folks are thinking of leaving. Why is that, right? So that survey kind of went on to say, look, 54% of people that leave are thinking about leaving because they don't feel valued, right? 51% say they lack a sense of belonging, but 36% of those folks say they're contemplating leaving because of the benefits. They can get better benefits someplace else. And that's where having this robust portfolio that we have available through camps is so important. We can help an employer meet the needs financially, as well as creatively giving a plan that's important to their employees to help slow that number down.
I'm so happy to get this information out to our camps members and even to a broader audience, because I think it's so important what the role that you're playing in offsetting the great resignation through great benefits, and one of the things we talked about in our earlier conversations, Claire, you brought this up. Manufacturers are really trying to encourage women to get into manufacturing, and they're trying to encourage women to get into leadership. And I know that that's a topic that you're passionate about. I'm wondering if you would share some of your thoughts on that.
Absolutely. Thank you for that. Well, being a female executive in a heavily male-dominated industry, it has taken, the career journey has been a winding road, as many do. I think the things that I really will impress upon people is making sure that we talk a lot about diversity, equity, and inclusion, but people, I think, have a difficult time understanding what to do. They don't want to do something wrong. They don't know how to put those policies in place. But honestly, I think a lot of this just comes down to self-awareness. How does an inclusive workforce look like? How do I make sure that I'm promoting more women in an industry that has historically been, male dominated? And we're talking about all women, women of color, young and older. And I think it really starts, Brady kind of hit on it. There is this kind of stigma. And, but I think the more we can invest in the trade schools and other kinds of maybe non-traditional avenues, we can start to develop the future women leaders that we want to see in these different industries. And I think it really is kind of dismantling some of that systemic, history of this being only for men. Men can only do this. And women obviously have a lot of contributions to make. And there is a documentary I really like. It's called Half the Sky. It's not around manufacturing per se, but it is about reaching our full potential. We can reach that through both male and female contributions in that. So I think the biggest thing I always say to folks is be self-aware. Think about how you're including, how are you promoting certain things? It can come down to words, it can come down to actions, but be that voice. I think we need everybody's voices at the table to kind of promote that. And it just will take time, but I'm really encouraged. I have a lot of work that I did in a nonprofit in Oregon around equity. And we're starting to see a lot of changes in industries that typically haven't seen women or women leaders. And so it is that formation of allyship and getting those voices at the table. It makes us all stronger at the end of the day.
I couldn't agree more. And I am seeing more of it. We're trying to encourage it at camps to see the manufacturing, which might have been very manual, very considered what a dirty job today, is very clean, very inviting, very technological, very automated. And so, yeah, there's a lot of room for women, but a lot of room for women leaders. And like you said, this voice at the table, and we are all better off for it. And so I really appreciate you giving all of us that encouragement. And we need that reminder, I think,
Yeah.
that there's great people around us, and we need to be inclusive and encouraging, I think, all the way around.
Yeah.
You know, and something that that I think has been so remarkable about Regence is the investment that you make in your community. So I mean, we talked about great investments in, you know, your product, your service, the members, and you know, people who use your service. But I think you guys go way beyond that into the communities.
Yeah, I think, you know, we just a couple statistics in our philanthropic organization. It's called Cambia. We have invested well over $15 million in our communities. Just this last year, we had more than 500,000 vaccines administered. We worked in the local markets here. Brady and I actually did that a couple of times.
Wow, nice.
He did it more than I did, but you know, making sure that we created a secure area for people to come to get vaccines. So it took a lot of on the ground work on that front. But we've spent hundreds of hours volunteering in our communities. We know that there are a lot of underserved areas that didn't have access to care during this time or access to the vaccine. So we went out to those underserved areas. Medical Teams International was one of our partners here in Washington. But we have a couple projects I just want to kind of call out because it talks a little bit, Kirk, about, you know, manufacturing, people in the manufacturing world, but also just making sure that we're recruiting a diverse workforce. And we have something called the Sojourns Scholars Program, and we've invested $1.8 million in that program. And it allows us to really focus on women, the BIPOC community, and others to draw in to different types of careers or different kinds of journeys that they may not otherwise know. So we are trying to diversify and really invest in areas that are meaningful, and certainly camps would be a recipient of that only through some of these work efforts that we're doing.
Yeah.
So.
Boy, you know, some of the words that you've been saying, Claire, have just been the exact things we've been echoing, and the same things I'm hearing from leaders in manufacturing. And I think it's wonderful that you guys are making that investment in the community, and these efforts today, again, are going to become magnified. I think it was a tremendous amount of money you guys spent last year, you know, to bring good things to our communities. So I want to say thank you to Regence and Cambia for, you know, making a difference, and that's really what you're doing.
Mm-hmm.
And you know, in conclusion here, you know, to wrap this up, you guys are playing a very big role, not only in, you know, Brady, we were talking about the attracting, you know, people make this decision to stay or to join, you know, a company because of the benefits that they have. And I think today we kind of gotten a flavor of what a great technological investment you guys have made to make healthcare accessible. And Brady, and you were saying like in your car, at work, you know, at home, wherever you are, right, with this mobile app. And then there were so many services that you just started to name off. I mean, there's something like travel care. You guys have a whole list of services, and they'll find those on the app. Is that right? They can explore that.
They can find them on the app, and it's also on regence.com, or their, you know, if their HR team doesn't have it, they can reach out to us or to their producer, and we'll get it to them.
Yes, and so I want to thank you because you are a great partner, and it's apparent that you're becoming even a better partner, if that's possible, because I can tell you're forward thinking, you're technologically minded, and you mentioned that you have the member, you know, at the center of your thinking.
Mm-hmm. I think it's really important, and Brady and I have a lot of conversations about this. We always have to come back to the member. How do we make this easier for people to get to the doctor, to access care, but also, even more importantly now, also the employer? How are we helping ease some of the administrative burdens, some of those kinds of things that, you know, are distractions, frankly, to their day-to-day work? So we are solely focused on making that easier. And I know everybody probably hears that, but I think our partnership with camps, with capital benefit services, with our team here at Regence, that we really focus on that and want to deliver that value so that it's really meaningful at that member level.
Well, that is so wonderful. And I'll just mention that if you're a manufacturing company and you would like to get access to the benefits we've talked about today, you can go to the Camps Health Trust at our Camps website, and I'll have all that information at the bottom of the video. And there might be people listening to this who are not in manufacturing who still think it's a great idea to connect with Regence. And so is that how hard is it or easy is it to get a hold of Regence and to get connected to a plan?
If an employer just wants to talk, so they can either contact their producer, right? The majority of our business comes through the local agents and brokers in the communities, or contact your producer, or you can reach out to us. You can find our contact information at regence.com.
You guys will help them through the process.
Absolutely.
This app works really well.
Yep.
Yeah, I'm actually very excited about your app and what it's doing for people, and I'm sure you just keep making more and more improvements on that.
It's the conduit to enablement. That's what it's convenient. It's there. It's fully integrated. That's why we keep going back to it. People are carrying these devices, and we just do so much from the palm of our hand. Why not access and manage your healthcare there as well?
I love it. I think it's fantastic. Well, you guys have been wonderful today.